next presenter is Rhonda Bavis, who will be presenting on the effects of parental substance abuse on children and families. She's mentored by Professor Shelley Weekelt in the Department of Social Work.
Good morning. My name is Rhonda Bavis. I'm a social work major with a minor in substance abuse issues. I've been working with Dr. Shelley Weekelt of the social work program as part of my minor requirement. Dr. Weekelt's been working on conducting a study on teaching substance abuse and its effects on the family to social work students. As my part of the project, I did a literature review on recent research studies that have been conducted on these effects. I'm going to talk a little bit about what substance abuse is first, and then talk about the literature review and some of the limitations that exist for the literature review. And then I'm going to discuss some of the current interventions that are being used with this population, and then finally conclude with some implications for policy, research, and practice. Substance use exists on a range, ranging from normal use or no use at all, to more problematic use, which includes abuse and dependence. There are two separate categories of substance abuse that I'm going to be talking about in this presentation: is substance abuse and substance dependence. I use the term substance abuse generically throughout the presentation to refer to those, but they are two separate diagnoses under the Diagnostic and Statistical Manual of the American Psychiatric Association, so they have their own criteria. Substance abuse is the less severe of the two, and it includes persistent, repeated use of substances despite negative consequences. And these consequences can have effects in areas of interpersonal relationships, social problems, often legal problems. There's abuse in hazardous situations like driving while drinking or using machinery while you're under the influence. Substance abuse is the more severe of the two diagnoses, and is primarily characterized by compulsive drug-taking behaviors or loss of control. Some of these behaviors include using more than you intend to use, using more often than is intended. There are often efforts to try to cut down or control the use. People might try to limit their drinking to weekends or to after 5 in the evening, and ultimately they're not successful in these attempts. Often they give up important activities that they used to enjoy because they are using substances. There's continued use despite increasing negative consequences, which can include legal problems, problems with families. Often they can lose their children, separation or divorce. And there's a preoccupation with the substance. People are constantly thinking about either getting it, they're taking it, or they're recovering from the effects of the substance. Over 22.5 million people in the U.S. suffer from substance abuse or dependence. It's all races, ages, and class. The majority of them have families that are also affected by these problems. Obviously, there are 8 million children who live with a parent who abuses or is dependent on alcohol or drugs. This is a huge problem, and it's important for us to understand the possible effects on these children, both over the short term and over the course of their lifespan. The literature review I performed, I used the search terms of substance abuse and dependence, alcohol abuse and dependence, family and children, and I used the PsycInfo, SochIndex, and PsycArticles databases. Some of the limitations to this study were the number of articles that I reviewed, and much of the research that's been done on this population has been small clinical studies. There's a need for more rigorously designed studies to better understand the etiology of this, as well as effective interventions for this population. Some of the recent research studies found these negative effects on family functioning, on personality characteristics, emotional and behavioral problems. There's a higher risk for substance abuse in this population. They found attachment issues, there were actually physical problems, cognitive and adjustment difficulties, and child abuse and neglect. Several studies indicated negative effects on the family functioning. These families experienced higher levels of conflict in the family, there was more blaming and arguing, and they had lower levels of positive interactions. These families tended to be less organized and cohesive. Impulsivity, lack of constraint, and thrill-seeking or behavioral disinhibitions found that were associated with parental drug use. Negative emotionality such as aggression, alienation, and stress were associated with parental alcoholism. Emotional and behavioral problems that they found were depression and anxiety. There's a higher frequency of violence in this population. There are adjustment problems and deficits in social confidence, along with a lower sense of self-worth. Parental substance abuse directly affects substance abuse and dependence in adolescence. It's a risk factor in itself, but it also indirectly affects it by increasing the risk for an adolescent to experience physical or sexual abuse, and that abuse in turn increases the risk for problems with substances. And the modeling effect by the parents was substance specific. Several studies looked at the effects of parental substance abuse on attachment. One of these studies found insecure attachment occurred with the children, especially in the daughters of alcoholic fathers. And these attachment issues carried over into their adult lives, causing conflict in their relationships. Family substance abuse is a strong predictor of child abuse, especially neglect. One study with a randomly drawn CPS sample found that 50% of the mothers in the study abused alcohol, 40% of the mothers abused drugs, and 37% abused both. And 86% of those mothers in that survey were perpetrators of abuse. It was primarily neglect. What can social workers and other helping professionals do? We can ask about it. We can routinely screen for substance abuse. We can be on the lookout for signs when we're assessing individuals and working with children and families. Some signs of substance abuse in individuals that we can watch for are changes in personality. The individual might be experiencing problems in legal areas, financial, marital, emotional, employment difficulties. It could be in a number of these areas at once. Pay attention if somebody no longer enjoys activities that they used to do and that were important to them at one time. When we're working with children, we can be aware of some behaviors that might indicate that substance abuse is a problem in the family. Emotional and behavioral problems, difficulties in school, including tardiness, absences, poor grades. These children might appear neglected and have frequent injuries. Interventions that are currently used, student assistance programs at schools can be helpful to the children. Programs are sometimes offered by treatment facilities. Mental health and primary care settings can provide treatment. And Alateen and Al-Anon are free support groups for family and friends of alcoholics. Alateen is geared towards adolescents, and Al-Anon is primarily for adults. Implications. It's difficult to tell what effects are specific to this population and what's typical for families that are dysfunctional in general. There's more research that's needed in this area. But children and families are negatively affected by parental substance abuse, and training's needed for school, health, and mental health professionals to effectively assess and intervene with this population. Not all the population will need intervention. Some children are more resilient than others, so careful assessment is needed. From a policy perspective, healthcare could pay for developing and implementing treatment for kids. It's important for us to continue to search for the most effective interventions, as these effects can carry throughout the child's life. And as social workers and other helping professionals, we can best serve this population by being aware of the magnitude of the problem, by screening our clientele, and advocating for effective treatment interventions. And I would just like to thank Dr. Wiekelt and the Social Work Department for the opportunity to do this research project.
We have time for a couple of questions.
Since substance abuse in population seems to be a major problem in the United States, what modes of treatment or therapy, as opposed to intervention, which is currently one of the main methods of treating the problem.
Right.
If you would like to prevent the problem in the future, what are some suggestions that you would take into account when looking at that as a social worker?
For interventions with the children, or interventions
children.
with children, well, they found that some protective factors are having an adult in their life who is not a substance abuse. It could be a grandparent or somebody who is very prominent and is a good influence in their life, does help with that as an effective intervention. Of course, not all children have that. There are many protective factors. You know, if the other parent, a lot of times I think with the mothers, if they were not the substance abusers, the effect tended to be less. So the closer parent could work with the child to try to mitigate the effects also. Does that answer your question?